I remember the day I first met Joel. It was on a Saturday afternoon.
Joel Wernick, I met early on.
I met Joel at a luncheon of the Albany Rotary Club.
I was asked to come and interview for the board.
We were both young.
He was like I was, a little bit younger.
Seemed like a fairly decent guy.
This guy walks in and I think, well, maybe this is a new doctor or a medical student.
He was doing so many things through the hospital.
And he tells me he's the new CEO.
Can't imagine a 30-something-year-old individual doing as many things as Joel Wernick did.
And little did I know the adventures that would follow.
He was a leader, an innovator, a creator, a globalist.
Praising Joel is something I never really liked doing. He gets enough of that.
We would typically be sitting in a board meeting, and Joel would bring up something that nobody else has ever heard of or even thought of, and he starts talking about it as if it were something that was really going to happen. And we would be very polite with him, and yeah.
A lot of people sometimes say that when the end of the world comes, you want to be in Southwest Georgia because it'll get there 10 years later. One of the advantages of that is that we could see a lot of trends that were taking place on the East Coast, the West Coast, and other more progressive markets.
Pretty soon we'd read where there's a national law or a state law or a regulation being proposed to do the very same thing he was preparing us for.
The board of directors of the Phoebe organization have always been an incredible group of volunteer community leaders. And so early on, we built a vision that frankly was going to take at least 15 to 20 years to accomplish. The major part of the vision was growth.
Building a trust is sometimes difficult today among even your friends, but Joel was the kind of person I felt very comfortable with.
The physician deficit became one of those key metrics that our board of directors both recognized and wanted to change. And so we came about with a strategy to create a residency program in family medicine.
We have medical students from the Medical College of Georgia as well as other medical schools. We have mid-level students from all over. This is planting seeds that will be oak trees in the future.
What we found is because we had a strong primary care base, we were able to also attract excellent specialists.
Joel's efforts to expand, to create more opportunities to serve patients has added at least 3,000 more jobs.
We are a 26-county region, and this is what Phoebe Putney Health System does. It takes care of all of these rural counties.
Not only with things like cancer, but also cardiac treatment, prenatal care. We're on top of it with the latest equipment, the best physicians and other caregivers, and the best services.
You know, part of our credo and our business plan was you don't have to leave Southwest Georgia to get big city medicine. And so we were always trying to accumulate and acquire a technology that sometimes was even ahead of what's going on in Atlanta.
I remember going into the neonatal unit, and Joel was able to show me every piece of equipment. He knew the names of the equipment. He knew the doctors that were operating the equipment, the nurses, the families.
Kind of the agreement I came to with our medical staff was, you're the scientists, you need to continue to push the edge for what you think is appropriate care. And I always would ask, is there anything you need? And is everything working?
He would listen to physician input, and that would influence decisions he made. And physicians realize that, and that establishes a trust.
He knows his hospital, not just the physical part of it, but the human side of it as well.
The image of Phoebe sometimes is large buildings and high-tech equipment, but I remind people, buildings and equipment don't take care of people, people take care of people. When I walk through our Philip Roberts Cancer Center, you're going to see a cross-section of people throughout the region. Some who probably could afford to go anywhere in this country, maybe even in this world, to get their care. And you're going to find people that probably had a hard time finding a ride.
If you come and talk to Joel about healthcare, he's so passionate about it. And he's passionate about helping people regardless to what level they are on or socioeconomic background.
The mission of Phoebe really has gone unchanged since its founding, and that was to be here for someone in need of healthcare services.
Phoebe is a huge cornerstone of Southwest Georgia. And if removed, we would collapse.
I think he woke up every morning wondering, what can I do to make healthcare better in Southwest Georgia?
So many people in leadership are frozen by ideas, frozen by challenges. I think Joel was at his best at those times.
So Joel's vision and his leadership went together, and he put it to good use.
Joel Wernick, I'm not really good at goodbyes, and I'm just hopeful that you'll always be around because we need you.
Stay focused on the mission. Understand that hard work pays off.
Come around and see us every now and then. Do all those things that you didn't do.
Understand where the vision of the next 10 or 15 years is going to be.
I will send him away into retirement,
Have your grasp be longer than your reach.
but I will say to him, keep doing good anyway.
Doing things that sometimes people believe can't be done. Live in the future, but take good care of people here in the present.